Siddharth Tambar. Welcome to our webinar today. So we are talking about what's new in regenerative medicine. This is December 3rd, 2025. We're going to run through the state of regenerative medicine today. Actually, before we get started, just a reminder that if you have any questions, please go ahead and put them in, and I'll go ahead and answer them as I get time during today's talk. If you have questions after today's talk, please shoot them into any of our social media sites or email, and we're here to help out. And if you ever want to be evaluated, please go to chicagoarthritis.com and just let us know. So in today's talk, we're going to talk about some key concepts in regenerative medicine. What do we know regarding indications? What about techniques of treatments that we're doing? What about complementary treatments, and any new sort of updates on regulatory and insurance things? So briefly, before we get started, just a little bit about who I am. My name is Siddharth Tambar, physician here at Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine and image-guided injections. In practice since 2008, involved in regenerative medicine since 2008 in the Regenix Network, which is the largest network of physicians who are involved in regenerative medicine in the world. I've been connected with them since 2012. Great. So as we get started, let's just make sure we're kind of level setting in terms of that we're all on the same page with things. Let's talk about some of the key concepts. First and foremost, with Regen Med, the reason why regenerative medicine is for a lot of musculoskeletal conditions is because it treats the root cause. So when it comes to treating musculoskeletal conditions, you want to be treating instability, you want to be treating inflammation, sometimes nerve issues as well. Regen Med does that. The other thing is, it's not good enough to just use treatments that are suppressing pain temporarily. It's that we want these to be disease modifying. So this concept of disease modification really progresses this way, kind of upward and worsening. Well, if you have a treatment that is disease modifying, you're now flattening out that curve so that it's not progressing in the same way. The more disease modifying, the better chance you have to really stabilize things and optimize things. Progressively, what we're coming to realize is that regenerative medicine treatments have that capacity. We'll touch base on that later on. So key regenerative medicine concepts that I think need to be background information that you need to understand are about stability, orthobiologics, interventional orthopedics. In part because this explains how these treatments work, and in part because that's how you can choose the right physician and clinics for your treatments. So when it comes to degenerative issues in the joint and tendons of the body, it is so essential. Stability is such an essential thing. So when it comes to stability, what we're talking about are the stability of the joints as they relate to each other. So there is this concept in architecture called tensegrity. What it means is that if you have individual units that are weak when they're alone, when you put them closer together and compress them, they are stronger as an overall functional unit. This concept in biology is called biotensegrity. And the idea being that, let's say you take a knee, it's not just the joint that's the problem, it's everything else. It's not just the cartilage, it's the ligaments, the bone, the tendons, the muscles, the fascial tissues, the small peripheral nerves. It's all of that connected together that offers more stability. Regenerative medicine works on improving biotensegrity. There is this concept called prolotherapy. We're injecting your own cells into the soft tissue structures around the joint. We'll progressively strengthen those structures and stabilize the overall functional unit. You have to do that in all the layers and depth of treatment. This will lead to progressive strengthening over time and longer lasting results. How do you treat instability? Conservatively, it's strengthening exercises and optimizing your weight. That means do the right strengthening exercises. If you have a knee problem, strengthen the hips and the legs. If you have lower back problems, strengthening the core and the hips. Optimizing your weight for lower extremity and lower back arthritis. Reducing weight takes the stress off, but also keep in mind that if your weight is above your optimal level, you may have metabolic issues, which can lead to more inflammation as well. So even in your non-weight bearing joints, let's say your shoulder, your elbow, losing weight can be helpful from a metabolic and thus inflammatory standpoint as well. That's not enough. I generally recommend using a Regen Med treatment to strengthen the ligaments, tendons, and other soft tissue structures to improve your stability. Things you want to avoid: surgeries that are only cutting out tissue, routine arthroscopy, clean out surgeries. For most people, no better than just physical therapy. Try to minimize steroid injections. If you're getting them too frequently, they can weaken the soft tissue and degrade cartilage. Too much of local anesthetics is actually dangerous as well for the joint, can actually degrade cartilage. There's treatments like radiofrequency blocks and genicular artery embolization that are meant to basically kind of disconnect some of your nerve fibers that are involved in pain. Nerves are important, not only from a pain standpoint, but a muscle strengthening standpoint as well. So some nerves are only sensory, meaning just for pain, sensation, but some nerves are also for motor, meaning controlling the muscles. If you weaken those muscles, if you weaken the nerve, you can then weaken the muscle. Keep in mind that those nerves that are also just sensory, that if you are purposely destroying those nerves, that you lose a little bit of the proprioception or awareness in space that joints have. That can also be a problem. Concept of prolotherapy. The concept is that you strengthen the ligaments and soft tissue structures, you overall improve the functional unit. There's also treatment. So basic prolotherapy is using dextrose or sugar water. It's the original regenerative medicine treatment. You inject that into soft tissue structure, strengthens it, and actually will improve things longer term. This has been around for many decades, and believe it or not, it still works. Then there's a more advanced version of prolotherapy where you're using your own cells, your own platelet cells, your own bone marrow stem cells. Another perspective on how to treat root cause issues is how do you treat inflammation? A few different ways. Number one, if your metabolic system is out of whack, you need to treat that. Insulin resistance is connected with inflammation. Obesity is connected with inflammation. Improve your metabolic health, you can improve inflammation. An anti-inflammatory nutrition diet is helpful. Weight loss is helpful. GLP-1 agonist treatments, things like semaglutide, tirzepatide, or the brand names are things like Ozempic, Wegovy, and Zepbound, can not only help with weight loss, but they can help with your metabolic health and thus inflammation, and in some cases, even pain. Other ways to treat inflammation. If you have inflammation actually in the joint or the tendon, chronic inflammation, low-level inflammation in a joint or tendon is not healthy. After an acute injury, inflammation helps you clean up and repair. Chronically, it's a problem. So you can actually optimize the joint and the tendons with some of these Regen Med treatments. Paradoxically, steroid injection, which help inflammation short-term, will actually damage tissues and leave it more inflamed long-term. That's different than a Regen Med treatment that can cause inflammation short-term, but helps things out long-term. So let me just catch up on a couple of questions there. Somebody asked about, do we do gel injections for knees? We do in some cases. Gel injections are mild. They are covered by Medicare. Not many commercial insurances are covering them any longer. When you compare gel injections for the knees to something like platelet-rich plasma, platelets do dramatically better. Not everyone needs to go as strong as platelets. Prolotherapy is a good option as well. And I generally would suggest that over the gel injections, but we will do gel injections from time to time as well. See a question on Instagram, somebody asking about solutions for RA hand damage. A little bit of a different conversation, but look, you have to control your inflammation first. If inflammation is controlled, generally speaking, for RA, it can be such a severe condition that you need medication to control the overall inflammation in the body. And if you're still having pain from prior damage and inflammation is under control, then some of the regenerative medicine treatments can be helpful. Okay, good questions. So regenerative medicine, these are treatments that utilize your own body cells to treat arthritis, tendonitis, injuries, and back pain. Utilizes the body's normal healing process, which includes the following. Let's say you have a cut on the finger. You have platelets that come in to first stop the bleeding. Those platelets then release growth factors, which stimulate your own local stem cells, which then brings in other cells and coordinates a normal healing process. Short-term inflammation, cellular repair process, longer term. Works very well for tissues that have good blood supply. Think your skin, think the liver. For tissues with poor blood flow, they don't tend to heal quite as well if they've been significantly injured. That can include tendons, cartilage, ligaments, discs, labrum, and menisci. So regenerative medicine is the process of injecting those same cells, platelets and bone marrow stem cells, to coordinate the normal healing process in order to recover from prior injuries. So regenerative medicine is a preferable option for musculoskeletal orthopedic issues because it treats the source of the problem, such as instability and inflammation, safer than surgery, effective for most musculoskeletal conditions, and really should eventually take over 80% of traditional orthopedic surgery will eventually be managed by regenerative medicine. In the same way, what used to be handled almost exclusively with open cardiac surgery is now handled by needle-based procedures, medications, and even some dietary things. So again, regenerative medicine works because it optimizes cells that have been damaged. Cells that have been damaged are not pumping out the right kind of proteins and enzymes, which leads to chronic inflammation. Regen Med can get those cells to start functioning better and more healthy. In addition, because of prolotherapy and improving biotensegrity, we can improve strength and stability of those supportive soft tissue elements. We can reduce chronic inflammation, as I mentioned, and we can treat some of those other nerve-related issues around the joint that's affected to actually improve things as well. So when it comes to orthobiologics, we're talking about the biologic cells and tissues that we inject into your joints and tendons. Again, utilizes your normal healing process. Please use your own cells, not somebody else's. Safer, and that's what's approved. So here are the treatments that are currently legally allowed and available. I'll actually talk more about regulatory things in a moment. Dextrose prolotherapy. That's the original prolotherapy. Generally, we'll take monthly treatments for 3 to 6 treatments. Platelet-rich plasma, it's where you use your own blood's platelets. Generally, if needed, we'll repeat treatment every 6 to 12 months, 2 years, right? Like it's a longer lasting treatment. Bone marrow-derived stem cells, strongest treatment that we have. And generally, if you need to repeat treatment, it'll be after about 5 years. Adipose, which is fat cells, this can augment platelets and bone marrow. Not really a stem cell treatment on its own, but it does have some structural and modulatory and immunomodulatory effects that can be helpful. So when it comes to platelets, that's really our initial orthobiologic. Again, platelets help after an injury, uses focused inflammation to help repair tissue damage, and the growth factors from platelets help to stimulate your own bone marrow stem cells. There's actually a lot on this screen here. Main thing to understand is that there's different types of platelet preparations. Your physician and clinic needs to have the intelligence, training, wherewithal to be able to create a plan that is custom fit for you. Your issue may require a different type of platelet concentration than, let's say, your neighbors. And if you're getting a one-size-fits-all treatment, you're not getting the right treatment. You need a customized bespoke treatment option because joints need a higher concentration of platelets, tendons need a moderate concentration of platelets, ligaments, you don't even use platelet-rich plasma, you're using platelet lysate, which is just the growth factors. Nerves use platelet lysate as well. So there's a lot of subtlety to these kind of treatments. Next kind of orthobiologic to be aware of are your own body stem cells, the main cell that helps to drive repair after an injury. Yeah. Stimulated by your own blood platelets. Use your own cells, please, not somebody else's. That's where all the data is. That's where the safety is. And your own cells will work for you. Bone marrow-derived stem cells are what's legal in the US. Fat stem cells are not legal in the US because it requires a manipulation of the cells that the FDA considers unclear if it's safe. You can use fat or adipose for structural support, and that's very helpful in that case as well. Amniotic umbilical cord cells, no living cells, not approved. IV stem cells, you may see that in other countries, no proven benefit for orthopedic conditions, may help with kind of general inflammation short term. You may hear about exosomes, that's another one. Interesting idea, really no data on its efficacy either, so not approved in this country either. When it comes to how do you decide which treatment to choose for you, yeah, your physician has to think about what's the severity of your issue, what other medical contraindications or complications that you have that make you a good or poor candidate for one treatment or the other. Is this an initial treatment or a booster treatment? Sometimes if you've had a bone marrow treatment or we're doing a booster treatment after a couple of years, platelets might be adequate. And then of course, cost as well has to be considered with all consideration as well. When it comes to stem cell treatments, yes, we can actually improve pain and function even if you have advanced arthritis. We can improve how your images look if you've got a tendon or ligament tear, if you've got swelling in a joint, if you've got some stress in the bone as well. Cannot necessarily get your cartilage to look different on an x-ray. That is not capable at this time, and frankly, x-rays are not made for that either. The next concept I want you guys to understand is interventional orthopedics. This is the process where we use. I remember a decade ago, I had some older colleagues that did not believe in using image guidance. They would just kind of palpate the skin and stick the needle in. If you're injecting cells, you can't be close. You have to be precise on the target. And to do that, you need to use high-level ultrasound and X-ray guidance because our targets are not big, large targets. They are sometimes millimeter or sub-millimeter in size. Picture on the left is an ultrasound of a rotator cuff. We're injecting directly into that very small little target. Image on the right is injecting, again, a shoulder under X-ray guidance, injecting the shoulder joint and the labrum. Hitting the labrum, almost impossible to do if you're doing it blindly, meaning just with palpation. You really need high-level X-ray guidance. These are pictures of the knees. On the left, it's an ultrasound image of injecting platelets into the patient's patellar tendon. Picture on the right is injecting bone marrow stem cells into somebody's ACL tear. So let's talk about what are the indications for regen med. This is being refined over time. What can we treat? Most osteoarthritis conditions if you have failed conservative options. This includes advanced knee and lower back arthritis. Would not recommend treating necessarily advanced hip arthritis, tends not to respond as well, but for other types of arthritis and other joints, absolutely. Also a good option for most tendonitis conditions. If you have just tendonitis or a partial tear, even if you have a full tear but it's not retracted, that can still be treated. If you have a full tear that's completely pulled apart, that one needs surgery. And after surgery, I would recommend augmenting that with your own bone marrow stem cells. For certain types of arthritis, let's say you have more advanced knee arthritis, or as some doctors will inappropriately call bone-on-bone arthritis, that can still respond pretty well to stem cell treatment. Keep in mind, it's not going to reverse the clock by 30, 40 years so that you have a brand new looking knee. It will optimize the joint, improve stability, reduce inflammation so that you'll have less pain and better function. On average, 65 to 70% improvement for 2 to 5 years. So still helpful even in advanced conditions. That's what I would recommend. Large joint replacement surgeries are not a benign procedure. It is a very involved thing. And thankfully, our orthopedic surgery colleagues are trained to do this. There are dramatically more risks with these treatments. understand that some of our techniques of treatment, if you've got more advanced arthritis, I'll touch on this later on, are refined as well. Ligament strains or injuries. Yes, absolutely still treatable, even if you have a tear. If it's a fully kind of pulled apart tear where the ligament is flapping in the wind, that still needs surgery. That can get retorn or re-injured in the future, so would recommend putting some bone marrow stem cells after that treatment. If you have a pinched nerve, let's say sciatica from the lower back or carpal tunnel or tarsal tunnel, these are still very treatable if you've got pain, tingling, and numbness. If you've got weakness, sometimes surgery may be a better option, but again, something to consider. What about inflammatory arthritis? As a rheumatologist, I would say if you have many joints that are inflamed, you really need to be on medication. But let's say you've got 1 or 2 joints that are a little bit mildly inflamed. I think these treatments can still be helpful. Let's say you've got bad rheumatoid or psoriatic arthritis, you're on medication, condition is well controlled, but there's still 1 or 2 joints that are mildly inflamed. Good option, these kind of treatments. Let's say you have some residual wear and tear arthritis from prior damage from your inflammation. These treatments are a great option. Bone marrow can do wonders in those patients. So timing is a very key thing here. So when do you treat? Old school thinking when it comes to joint and tendon issues is wait till your symptoms and condition is severely advanced and now you're in just terrible state. That is, if we did that in other medical conditions, let's say diabetes or high blood pressure, which is how people used to treat it, they would wait until your condition was severe. Well, you have very bad results. Same thing with your own joints. A newer way to treat this is treat early if you're feeling conservative treatment. So let's say you have knee pain. Do some PT, do some supplements, some weight management. It's not cutting it. I would recommend escalating to a regenerative medicine treatment. Why? Number one, don't wait till things are severely worse. These treatments can be disease modifying, meaning because you can improve stability, reduce inflammation, keep you physically active, you can prevent this from getting worse. So disease modifying is key. In addition, let's say you've had a recent injury. I wouldn't wait until things have gotten dramatically worse. If you're not getting better quickly with just some physical therapy, you should be considering these treatments. You may have some chronic instability that would benefit from treatment. So timing is important. What else about timing, right? Number one, repetitive treatment can be additive. When we say additive, it means that there's a stair-step function. These treatments will take a little bit of time to kind of kick in and get you well. Your results will be slowly improving for months. For platelets, it'll be for 6 to 9 months progressive improvement. For bone marrow, it'll be 12 to 18 months progressive improvement. Once you're at a steady state, you'll be at a higher level and you'll stay at that level higher unless you get re-injured or something like that. If you end up getting a repeat treatment at some time, you're now starting at a higher state and now you're stair-stepping to a higher level. Because of that, chronic osteoarthritis can be treated chronically. Let's say you get a bone marrow stem cell treatment for your knee on day one, you'll have some improvement, progressive improvement for the next 5 years. You may need a repeat, let's say booster treatment, let's say platelets after a couple of years to kind of keep things going. But now in this case, treating your chronic osteoarthritis can now be done appropriately, safely, and in a disease-modifying way, treating it chronically. The other thing is understand that, when it comes to your musculoskeletal health, fixing the problem, what does that really mean? If you get, let's say, a joint replacement, you're not fixing the problem. You're amputating out the joint and you're now putting in metal prosthesis. We're not cars, right? You have cut out something and you now have a prosthesis there. This is not like, the way to think about the body is how do you optimize and maximize things? And that's how you should think about your joint health as well. You can optimize things so that the joint is more stable, less inflamed, so that you have less pain, you're functioning at a higher level, you're maintaining your weight, maintaining your strength, staying physically active, living a better quality life, high quality life, so that you are now optimizing and maximizing things. I think that is a better way to think about it rather than fix, which is a really weird term when it comes to the musculoskeletal part of your body, because we're humans and most people come in with chronic issues. if you come in with, let's say, a recent injury, a mild to moderate sprain of, let's say, an ankle, that could actually get fixed, right? You could actually treat that soon. Most people don't come in like that. Most people will come in and say, well, I sprained my ankle 25 years ago, and then I sprained it again 5 more times, and then I've had 6 cortisone injections, and then I then injured a tendon, and now I've got a little bit of arthritis. That is, you're coming at that can still lead to a very good result. So, what are some of the new things from the technique standpoint? Excuse me. Thank you. Well, we know a couple of things. Number one, progressively, we know that you need to treat comprehensively, meaning treat the entire functional unit. Treat all the sources of pain and root of the problem: ligaments, tendons, joint. Treat above and below the affected joint if needed to improve stability. Treat a nerve issue. I think these things are becoming more and more clear over time. Part of it also means if you've got more advanced arthritis, you may need to treat the bone as well. Why is that? So your cartilage on its own does not have great blood supply. It gets blood supply and nutrients from the bone. So in more advanced arthritis, you will sometimes see swelling in the bone, not just the joint, but in the bone. That means that the normal nutrients that are passing along to the cartilage are now being limited. So what we will frequently do in more advanced arthritis in that case is actually not only treat the joint, the ligaments, the tendons, all the other structures, but we'll inject into the bone as well. The reason why is that, number one, it'll actually help with pain longer term. Number two is that it also has a potential to be disease modifying. If you can improve the blood flow to the cartilage, you can actually help to preserve that longer term as well. And so progressively over the last couple of years, we've been doing a lot more intraosseous treatments in advanced osteoarthritis because of that disease modifying function. Maybe some benefit in certain types of tendon issues as well, still kind of being worked out, but on occasion for tendon issues, we may actually treat the bone as well. It's an evolving area of how we're doing these kind of treatments. Other thing that's very clear, a lot of us in the know have been doing this for a while, know that dosing matters. Higher dose platelets matters, higher dose bone marrow stem cells. There's more and more evidence that, hey, you need to really have like 10 billion plus platelets. You don't get that from like a small blood draw. You need a larger blood draw. Starting to realize something we've known for a while is that you need a higher concentration of cells in your bone marrow in order to get a better result as well. So dosing matters. That evidence has been re-emphasized this past year. Low dose means low results. High dose generally means better results. Your physician needs to be aware of that, because if they're utilizing a low dose, you may not be getting the right result. And frankly, they may not even know what dose that they're giving. That's another problem. The next thing to kind of keep in mind is optimize your substrate before treatments. What do we mean by that? Optimize your own whole body before treatments can be helpful. Your joints are part of your overall system. There is a need for being relatively holistic with this. So if your metabolic health is not ideal, try to improve that. Diet, exercise, weight loss, right? There's some interesting kind of limited data that shows that if you do intermittent fasting the week before a bone marrow, you can actually improve your bone marrow cell count. Something to keep in mind. Hormones are definitely connected with our joint health as well. If you're low testosterone, testosterone replacement can actually improve your bone marrow stem cell count as well in men. And your muscle strength. Try to maximize as much as you can prior to treatment. Muscles help with stability, can help your treatment as well. Optimize things as much as possible to optimize your results. Just catch up on a question here. Somebody asking about what can we do with a bad hip? It really depends on how we are. What do you mean by bad hip? Are we talking about you have severe hip arthritis, in which case I would say probably surgery is the right way, hip replacement, realistically. Or are we talking about you've got significant tendon issues, or you've got a pinched nerve in the lower back, or your SI joint, like, and maybe you've only got mild to moderate arthritis, in which case then a Regen Med treatment can still be helpful. Somebody asking about, yeah, okay, we will get to that. I see a question about cost of treatments, we'll get to that. Complementary treatments. There are so many complementary treatments when it comes to musculoskeletal health. There's the traditional things, physical therapy, weight loss, chiropractic, red light therapy, acupuncture. I think all of these have their value and can be very useful. So many different options. Some things in the last year or two or few years that have been getting a lot more attention, shockwave. That's something we've been doing a lot more of. Helpful for tendons, ligaments, even myofascial tissue. All that can help even in arthritic joints as well. I think shockwave is a nice complementary option it's a nice option on its own, but I think it's a really nice complementary option for Regen Med treatments as well, in large part because shockwave helps improve blood flow as well, and that can be helpful for the Regen Med treatments also. So I like it as a complementary treatment for sure, and one that I would strongly recommend thinking about. Another one that I hear a lot of patients talk about are peptides. Peptides are small little pieces of proteins or proteins themselves that help to stimulate different systems and processes in your body. Things like GLP-1 agonists, like Ozempic and Mounjaro, those are actually peptides. There are other types of peptide medications, but in the joint health world, you're hearing about things like BPC 157, TB3, TB500, some of the growth hormone agonists. There's probably some benefit there, but you need to understand there's little to any human evidence on using these treatments, which is a bit of a challenge. Or there may be, but it's like very limited. There's a lot more like animal kind of studies and all that. I think if you're going to do peptides, I think you need to work with somebody, a physician that knows what they're doing, that's highly experienced in this. I don't think there's any contraindication from a Regen Med treatment. May be helpful, may not. Again, there's just limited data out there from a safety standpoint. There may be, you just need to be aware that some of these treatments need to be for limited duration. Some of them you can maybe use longer term, but some of them need to be limited duration because there may be some unclear other side effects when it comes to potential cancer risk in some cases. So be cautious, it's still newer. Just make sure you're working with a physician that knows what they're doing. Regulatory issues. So dynamic environment. In the last 5 years, I would say, I think it's become a lot more clear what the FDA wants. Now, this could change over time. We know for sure PRP and BMAC, or bone marrow stem cells, for orthopedic and musculoskeletal issues, if you're using your own cells, are definitely allowed. They meet the criteria. Adipose or fat can be used as a structural issue. Again, need to be careful if your physician is trying to use it as a stem cell treatment, because the FDA is not really excited about the enzyme that you need to use on adipose. Birth cord fluid treatments, that includes amniotic fluid, that includes placental cord fluid. Understand that they are not currently allowed for musculoskeletal conditions. You may be able to use amniotic fluid for things like wound healing, but for musculoskeletal treatments, these are not really approved at this time. Exosomes, you see a lot of advertising for exosomes, idea being that you're taking packets of growth factors that are released from stem cells and taken from other people and using it now in someone else. There's really no data on this for musculoskeletal health. It's still not approved, all right, by the FDA. I'd be very cautious with that as well. When you have the option of using something that's approved and proven and studied using your own cells, PRP and BMAC, that's what you should be focused on at this time. And frankly, that's what every legitimate doctor should be using. Insurance coverage. Look, there's no reliable general insurance coverage by Medicare or by your traditional commercial insurances. So this is still mainly an out-of-pocket cost. Some exceptions to that would be, let's say you have an HSA plan, you've got saved up money. Sometimes these things can be covered through that. But if you're paying out of pocket, expect the following. For something like prolotherapy, cost will be about $650 to start. per treatment. For something like platelets, it'll be about $2,500 to start. For bone marrow stem cells, closer to $7,000. Those are realistic cost estimates around the country. One exception to insurance is if your company offers some of these treatments via their insurance plan. Regenix, again, we're part of the Regenix network, has what's called the Regenix corporate plan. You can go to regenixcorporate.com to learn more, where they set up these treatments to be incorporated into your company's benefits plan. If you can do that, then this is covered like a normal insurance covered product. We have a lot of patients who have that. Fortunately, we have companies around the Metro Chicago area that have included this, as well as Wisconsin, Indiana. So we see those patients, and we are able to provide treatments through their insurance coverage in that case. I'll get to some of these other questions. A bunch of other questions. Let's see. Person asking about the hip again. Unfortunately, if it's advanced hip arthritis, you probably are best served looking at hip replacement surgery. If you end up going with a Regen Med treatment, let's say bone marrow stem cells, that's the strongest option there is. Your chance of getting a good result is probably 1 out of 3 chance. If you end up doing bone marrow stem cells, I would recommend, mentally consider you'd end up probably getting almost an annual bone marrow treatment for the next couple of years to see if it's going to be helpful. So it's an involved process. It's still up in the air. Advanced hip arthritis is a hard one. Yeah, to see some of the other questions on our social channels. Here's a question from YouTube asking about platelet-rich plasma and/or platelet lysate for SI joint pain. Yes, absolutely. The SI joint is the back of the pelvis, the back of the hip, and drives so much. It drives about 30 to 35% of lower back pain, drives a significant amount of hip pain as well. In my experience, PRP treatments in the right patient with SI joint issues is very helpful. If you also have a hip issue or a lower back issue, you need to make sure you treat that as well. The SI example that I give to people is my own mother, who, after giving birth to me, and then a couple of years later, my brother, had some chronic hip pain. I recognize this literally decades later as a physician. I've been treating her SI joint probably once every 7 years or so, and she's done very well for the last 15 years or so, treating her SI joint. So great option for SI joint pain. Another question asking about clinical trials showing the effectiveness of PRP versus steroids. Yes. So when you look at PRP versus steroids or PRP versus hyaluronic acid for knees, PRP works much better longer term. You find steroids give pain relief for the first month or so, then taper off. Hyaluronic injections progressively give pain relief for 3 to 6 months. PRP will give pain relief and better pain relief 6 to 12 months and longer than that. So yeah, absolutely. Also PRP versus steroids for elbow tendonitis. Again, PRP is the preferred option. How to get evaluated? Contact us at chicagoarthritis.com. Contact us via our social sites. After today's webinar, you'll end up getting a link for a replay that you can watch yourself, or you can share with friends, family, or colleagues. You can also email us back on that, admin at chicagoarthritis.com, an evaluation to see if you are a proper candidate for treatment. Wonderful. Well, we're getting to the end of our time today. If there are no other questions, I will sign off at this time. Thank you, everyone, for taking the time to talk today. Look forward to connecting again in the future. If you have any other questions or want to be evaluated, please contact us at your convenience. I hope everyone stays warm in this cold weather, stays healthy, enjoys the holidays, and until we connect again, have a good day and live well. Bye-bye.